Good day, everyone. Thank you for giving me the opportunity to share some of the research that I've done, which is around advice for stroke-related upper limb spasticity rehabilitation. The problem was initially discovered with a patient that we'll call Heather, who is a 76-year-old lady who suffered a left hemisphere ischemic stroke. This left her right side of the body completely paralyzed. And she was then bound to a wheelchair. Soon after, she started experiencing upper limb spasms, which resulted in something called clenched fist deformity, which you'll be able to see in the right hand picture. She had to engage in quite a lot of physiotherapy and occupational therapy during her recovery period. And one of the things they did was to put her into a wrist splint. But if you look on the right-hand image, circled in red, we can see that there are a number of pressure sores that have resulted from this, as the arm spasms uncontrollably into the splint, which causes a lot of pressure and a lot of pain for Heather. So we identified the problem that needed to be solved as a way to address arm spasms causing pain and bodily change for people suffering from uncontrollable spastic reactions, so as to limit the pain and the bodily deformity caused by such a disorder. This is really important, as there are worldwide 15 million strokes a year, and 3/4 of all these strokes occur in people older than the age of 65. What happens during a stroke is there is a change in the blood flow to the brain or the central nervous system, and this can occur if there's a clot in the blood vessels, which reduces flow, or if there's a hemorrhaging of the blood vessels. So this is what an ischemic stroke would look like, which is on the left, and 80% of strokes are ischemic, whereas the rest are hemorrhagic. Hemorrhagic will often lead to death. So what happened to Heather was there was a control loss. The brain loses control of the nerves that signal the reflex arc in the arm, and she ended up with clenched fist deformity. This meant that all of her flexor chain would uncontrollably spasm, causing her a lot of pain. And the only way that she could get herself out of the spasm and her pain was with physiotherapy. However, the physiotherapy was only 2 to 3 times a week, as funds were quite limited for her. If you look at the track of care for stroke recovery, there is a lot of engagement and a lot of money that needs to be spent on therapies during the recovery. While stroke patients can recover, often they'll have to do therapy for much of their lives. So this led us to the device called the Open Air, which is a soft hand spasticity relief device. The device is based around a pneumatic finger opener, which works on the theory that if we inflate balloons above the hand and away from the reflex pathway of the palm, that we can gently open up the hand that is spasming and spastic. The Open Air contains a wrist splint, which keeps the arm keeps the hand or wrist rather at a 45 degree angle, which is to reduce the chance that the hand will spasm. And then it also includes dorsally located balloons, which are inflated to open up the hand. It is forced as the air increases, the balloon increases, and then pulls on the pockets around the fingers, counteracting the forces that the tendons in the hand are putting on the hand. The inflation mechanism also uses a technique that is quite common in recovery of stroke patients, where they would lean onto their affected arm. And this also helps with the independence of the device. The working mechanism is that the patient leans onto the device, which then inflates the glove. Our testing, we did 4 tests, testing static load, the range of motion, the force over time, and then the failure modes. We found that it could apply the correct minimum torque and that it still allowed for the complete range of motion of the hand. It was able to be controlled by the affected hand, which was quite important for the independence of the person using it. It's able to be donned and doffed by the patient without aid of others. It allowed for opening of fingers without overextension of the hand, which was also very important. Orthosis should not force the pain through any patient pain tolerance, and this was seen as the patient can control the rate of inflation and thus any sort of pain experienced. The glove itself is also not greater than 450 grams, and the glove also managed to position the arm better at rest to alleviate further spasms. So the areas of application were that it was a device that provided comfortable independence to the task of spasm relief in individuals with upper limb hypertonicity. It allowed for ongoing and patient-aligned spastic rehabilitation for patients and clinicians alike, and really allowed the patient independence in their recovery, which is very important for stroke rehabilitation, as when a patient believes that they can recover and that they are part of their recovery, there is a much higher chance that they will recover. Thank you.
Thank you very much, Matthew. The ingenuity and the simplicity of this invention is really remarkable. We don't have much time for questions, but just briefly, could you tell us how acceptable you found it to be to patients? Did they enjoy using this device? What were their reaction?
So the people that did use the device in this preliminary study were healthy patients, and we were just doing sort of bench testing, prototyping. But everyone was very impressed that the rate at which it forced your hand open. It was very gentle, but in a forceful manner, if that makes sense.
Yes, well, we look forward to hearing more about this in clinical population, and well done.
Thank you.
Thank you.